I am ready. Can you hear me okay?
Yes.
Great. And now you can see me.
Yes.
Hey, thank you so much for having me on this. This is the solidarity it takes amongst all the people to put something like this together. It's amazing. I'm just honored to be a part of it. Thank you. Uh, my name is Garth Mullins, and I'm talking to you from Vancouver, Musqueam, Squamish, Tsleil-Waututh territory. And I'm the host and executive producer of a podcast called Crackdown. I'm also a person with a disability, disabled person. I have, I'm blind, and I'm also a drug user and have been for most of my life. Opioids has been my thing, and spent a lot of activism working around the overdose crisis that's taken a lot of people. And doing this activism has exposed me to um, certain truths that are very common to people who use drugs. I think they're also common to people with all kind of marginalized situations, like people who face um, the healthcare system from a position of less power. And it's been the story of my life too. And I think about Bill C-7 and we're assured that there are these safeguards, that we have this idea that there's a just system out there that's going to prevent any kind of abuse, that's going to prevent the kinds of things that people have been warning about from the disability community and from this filibuster. But I don't believe that those things are there. My own experience has showed me that they're not there, and so have the experience of the people in my community, my friends, my comrades. And I just wanted to share a little bit of that with you tonight. Um, People have argued that Bill C-7 is harm reduction, and I don't think it is. I know what harm reduction is because I've been practicing it and advocating it most of my adult life. And this is the idea of a bad situation. For example, harm reduction really came out of the harms caused by the fact that there's a drug war that's been going on for a century, and so there's a lot of harms that come out of that. There's harms that come out of, for example, when you don't have adequate access to new syringes. People share, and there's transmission of HIV and Hep C, and so to reduce the harm that comes out of that, we fought for new needle distribution. And as overdoses were taking people, we fought for safe injection sites where naloxone could be administered and people could be brought back. These are ideas that came from our movements, that came from us, that were the result of struggle and civil disobedience. They are not ideas that were brewed up somewhere else. And they were not ideas that were implemented as the result of horse trading between parties, between political parties. They came from below. They didn't land on top of us like a spaceship or an anvil or something like that. So they're insurgent. We practiced these ideas first ourselves before they were legal. We put them together as community members trying to keep each other safe. Needle distribution was at first illegal and done out of backpacks. People would find medical facilities with needle supplies and steal boxes of them and give them out. Places like safe injection sites were opened without permission first by activists, by people who are not paid, who are just trying to save each other's lives. And eventually, programs like these were sort of made legitimate by the embarrassment that the state was feeling at us doing it ourselves. And so when someone says Bill C-7 is harm reduction, it's not the way I understand it, not the way I've lived it, experienced it, and practiced it, not the way that harm reduction has saved my life. But part of that bill is the understanding that, don't worry, Canada's this great place with this universal healthcare system to take care of everybody, and there'll be guardrails and there'll be protections, and that's not the healthcare system that most of us have experienced. We found a system that treats people very differently depending on if you're Indigenous, Black, or person of color, if you're a woman, if you use drugs, if you're trans. All of these things can kind of count against you when you come into contact with this system. And definitely if you have a disability. I'm going to talk a little bit about some of the intersections there that I've seen. And I think about my best friend when I think about this stuff. My best friend since since I was a young guy, and him and me have known each other forever. We've been heroin users together for a long time. We've tried to keep each other safe. He's kind of pulled me out of jams. I've pulled him out of jams. I stood up for him in court and said, you know, he's a good guy. And a couple of Christmases ago, I lost track of him. You know, we call each other a lot, and we go for breakfast and stuff, hang out like more when there's no pandemic. But you know, this was how we'd been, and all of a sudden he's just like off the radar, right? And lots of people are dying of overdose, and I was worried that he was dead. And eventually, days later, I get a call from the hospital, and somebody, like, think a nurse, says, "Oh, your buddy's here." So I go find him. You know, I go and follow the taped lines on the floor that are this color, that color, to, you know, wait to go follow the green till it intersects with the yellow, go up the stairs, up the elevator. Anyway, I finally get there and I find him. He's not looking so good. And we chat for a while. And I said, "Hey man, why did you wait so long to get a hold of me?" And he's like, "Oh, no. You know, they wouldn't give me my phone call." And I said, "What do you mean? You can have as many phone calls as you want." He's like, No. You get one phone call. That's, you know, you get one phone call." And he's looking at me like I don't understand. And I said, "No, this is not jail. This is the hospital. You can, like, you're allowed to communicate, you know?" And he's just shaking his head at me like, "You don't understand." And, you know, he's right. I didn't understand. I'm I'm a white guy, and I haven't lived his life. Like, he's a 60s scoop kid. He got taken from his mom when he's 8 months old off of the Curve Lake First Nation. And he's experienced the carceral system for a big chunk of his life. And he just feels the same kind of power at play inside the medical system. And there aren't safeguards there for him. And I was looking at him, and he was in a lot of pain, you know. And so I you know, tried to have conversations with the nursing staff or stuff around him. I kind of pretended I was a social worker and tried to seem official, you know. And there's a real, like, they don't want to give people pain meds. And so in the podcast, I was thinking about this, and we did a whole episode on the great deprescribing that's happened across North America, the giant pill panic where doctors forced people off. And this affected the drug users like me, because we couldn't get access to something like that was maybe safer to keep our habits going, and to use something like that was not as risky. But also pain patients who were really relying on it. We were in the same boat. And so when I did this episode, I did follow my friend there, his situation, but I also talked to a pain patient journalist and advocate. And I'm just going to get the exact what she said so that I have the quote right. Her name was Dawn Marie Downton, and she lives out east. She's a writer and journalist, and she's a pain patient advocate with sacroiliitis. I hope I said that right. And I want to take you back to the time she told me about what happened with her getting cut off pills. And you'll see why this is so connected to Bill C7 in a second. Dawn Ray says, it was winter, right? It was Nova Scotia. I was in this big brown parka with the big hood and fur and all that. And I hadn't taken it off. I usually didn't, because my appointments were pretty short. But for some reason, I decided to take it off today. And I was in one of those little exam rooms, and she came in. This is the doctor. She came in, and she was wearing a yellow sweater, and she was wearing a kind of checkered skirt. I remember it was a kick pleat. I remember it had a kick pleat, she says. And Dawn Ray is saying that the doctor told her bluntly, "I can't prescribe you fentanyl anymore." And this fentanyl had let Dawn Ray have a life where she could write and read. And she was a journalist and a writer, and that's what she wanted to do. That's how she really expressed herself. And before that, when she was just having the pain of sacroiliitis, she kind of couldn't focus. It was just all consuming. And so she said, this is what happened to her. And she got cut off. And she said she's been active since then. And she said to me, I have a lot of people to this day contacting me about suicide plans because I have one and I've said that I have one. And so that was her reality, right? Without access to opioids, something so simple, she and lots of other people she knows and works with and have reached out to her have had to make suicide plans. And if you have a bill that nudges that along, instead of what she would want, what she said to me is just prescribe the stuff. She just wants the option to prescribe the stuff. She doesn't need to end her life. She knows exactly what she needs. She needs a fentanyl prescription to manage the pain. And I just think about the thousands and thousands of people across Canada who are in that situation, who've been cut off their prescriptions and they're on pain medication. So I mean, they have experienced this as pain patients. They experience people with lots of like chronic conditions or injuries at work. I worked construction and demolition and mining, and so I've seen lots of bad accidents, and I've known lots of people who did also rely on opioids to sort of manage their pain and manage their life. And I guess there's people like me who've used opioids since I was a teenager to manage what it turned out was trauma and PTSD. And I didn't know that until more recently, but I was just using heroin to get a sense of control over my life and to really to put a lid on those feelings like, I don't want to be here. I want to get out of here. I want to check out. And so the whole world of people who are trying to self-medicate and manage are excluded by this medical system that's supposed to be full of guardrails and protecting us, so safe, such a well-sealed safety net that we can contemplate something like Bill C7. And I think about the experiences of other of my friends, and I'll just tell you about Tracy Morrison. Tracy was a leader of the Western Aboriginal Harm Reduction Society. Just like a fantastic, outspoken person. She was one of the people who taught me how to talk like this, how to just say, yeah, I use heroin without, I don't know, looking down and feeling ashamed and kind of qualifying it and burying it. She used to just tell people at the beginning, she's like, yeah, I smoke crack. And I just was so gutsy. She was known around the downtown east side as the Bannock Lady because she made the best bannock, hands down, everybody agreed. And she was the president of this group, the Western Aboriginal Harm Reduction Society. And she also really sort of put her hand on the wheel of the research agenda of that group. And one of the papers that she co-authored was I'll read you the exact title. It was called "They Treated Me Like Crap, and I Know It Was Because I Was Native: The Healthcare Experience of Aboriginal People in Vancouver's Inner City." And you can look that up. Tracy Morrison and a few others co-authored this paper and did interviews and research with people about what their experiences as Indigenous people in the healthcare system were. And you just get all of this, really, really rough experiences of systemic racism, of not being heard, of really feeling on the wrong end of that power relationship, and people just bouncing out. And I think a system that does that so universally shouldn't be holding that kill switch in its hand. That just seems like that bill is designed by people who don't understand this. Tracy died of overdose in 2017. And like a lot of the leaders and activists in our movement, she's gone, and no one has really filled the space that she did leading us all. I miss her all the time. And then the other thing I think about is my friend Martin. He disclosed to a doctor about his drug use, his illegal drug use, and the consequences were quite bad for him. His whole treatment situation changed, and a discussion around this triggered research by a guy named Boden Nozick and a bunch of other researchers. And I'll just tell you this. The research paper is called "Non-Disclosure of Drug Use in Outpatient Healthcare Settings, Findings from a Prospective Cohort Study in Vancouver, Canada." I'll just read you the conclusions. It says, conclusions: In a sample of people who use drugs accessing outpatient healthcare services, we observed low rates of drug use disclosure, particularly for Indigenous respondents, and reduced quality of care for those who did disclose. So the conclusion is people don't want to be truthful with the doctors. And when they are, it doesn't work out so well. These are like just, I'm giving you some anecdotes, but I'm also trying to give you the research here to see that people who use drugs experience an entirely different medical system from the one that's in the imagination of the drafters of Bill C-7. We experience this second tier, ghettoized, sort of sometimes privatized and unregulated track. The methadone clinic where I go to charges you fees. It's private. Most of them are private. Most of them you got to pay some kind of fees. The pharmacist that gives you your methadone and watches you take it, because you are not trusted for the most part, that's a private operation too. You go into these clinics and they do one thing, they write on a prescription pad, and then they also piss test you. They test your urine to see if you're using other drugs, because that's what they want. They have a particular idea where you should be going and how you should be fixed. And they want to head you there, and they want to communicate to you there's not trust, that you are policed. And I always think about this. This is the last academic quote, I promise you. I always think about Philippe Bourdois from a paper in 2000, where he talks about, it's called Disciplining Addictions, the Biopolitics of Methadone and Heroin in the United States. And their clinic experiences it's organized differently, but the elements are the same. He says, the phenomenon of the methadone clinic is an unhappy compromise between competing discourses, a criminalizing morality versus a medicalizing model of addiction as brain disease. Treatment in this context becomes a hostile exercise in disciplining the unruly misuses of pleasure and in controlling economically unproductive bodies. And that's just, sometimes I read stuff like that and I'm like, God damn, yes, that's what I know, and so of course I'm much more likely to read that part to you, but I sort of struggle to paint a clear picture that's a little bit of stories and a little bit of research to show exactly what's going on in the medical system, in the world that we go to inhabit. And I think, how do we fix this? There is so much missing from the healthcare system. Like, I don't know what is in the imaginations of the people who write this, but it is not what I experience. And when I see people on Twitter, like, proud Canadians, like chest thumping about how great the healthcare system is, I'm just like, this is such an out of date idea. Like, maybe we should be celebrating it when it was just happening, when Tommy Douglas was there and we finally, the fight was finally, rounding the corner, but that was 50 years ago. And this is an unfinished system. This is a place without all the safety guardrails that we're told of. And here's some of the things I think are missing. Palliative care is missing. Pain medication is now missing. Long-term care is missing outside of this system, privatized hellscape. Mental health care isn't there. So, when I found out, for example, that I had PTSD, I didn't find that out from some treatment available in the healthcare system. I have a union job with extended healthcare benefits that paid for it. It was $200 a session. I went 4 or 5 times, and it was amazing. Everybody should have access to it. They shouldn't have to have a union job with healthcare benefits. It should be part of the system. So the fact that they are proposing such a drastic conclusion when they haven't put any of the things in place to help people live, that you don't want to help people die before you help them live. I mean, that's my feeling, but it's not just missing, proper mental health care. You can't get specs like eyeglasses or dental. And you also, the system is missing things that would make everything better. Wealth redistribution, like trying to make your way when you're absolutely skint is really difficult, and if you have a disability, it compounds the effect. Housing and like agency, like just self-determination. That's probably the thing that's the resounding theme through all the examples that I've shown, is that the people do not get agency. You get this stamp on you. Sometimes they actually write it in your chart: drug seeking behavior. Like you're there with some kind of scam and you're just trying to get pills out of them. And we all need to see the doctor. Sometimes there's lots of things that are wrong. Sometimes what's wrong with me is that I'm ferociously dope sick because I'm wired to opioids and like lots of people are. And yeah, probably sometimes I do seek to not be that way. Certainly we have 20,000 deaths over the last 5 years that show that being dope sick is really, really fatal right now, because people use off the contaminated drug supply and overdose and die. So that agency that's missing out of there, that's the ingredient, right? If we can't make simple decisions, if we get stereotyped, if we get, as Tracy Morrison says, treated like crap because they know we're native, if we get sidelined or marginalized, then how are we supposed to be able to make decisions? How are we supposed to have agency over such big topics like what's in Bill C7? If we can't have the small agency over the small things, if I can't control even the tiniest things about my life in the medical system, how about the big things? I don't know. This to me is why I'm against Bill C7. It's also because I have seen the look. I've seen the decision. I've seen this like switch go in someone's head when they decide this person in front of me is a write-off. Like they're just too much of a junkie or a dope fiend, or they're too fucked up or whatever. And it's just like, I don't care, or I don't have the capacity to do anything, or I don't have the systems available, or the system isn't set up for this. And I think about my friend from, the beginning of when I was talking, the guy in the hospital over Christmas. He's still alive. He's still with me. He's still my good friend. But, he needs just a couple of simple operations to sort his life out, to improve the quality of life a lot. But when doctors think, oh, you're a write-off, like you're too messed up, we're not going to invest in you. Then that to me is a scary harbinger of what kind of things would be lurking in the minds of decision makers, who would be using Bill C7, who would be using the law to make determinations about whether someone's life is worth it, And people told me this all my life. Oh, you're so pessimistic. You're always so negative. You always see the worst outcomes. And I'm like, no. I believe we can change the world. So I'm an optimist. Maybe I'm even like a Pollyanna-ish in that thinking. But I think that I have not projected as bad of outcomes. Like systems have worse consequences and outcomes than I expect. Like I see them setting them up. I'm like, oh, this is going to be bad. But then I'm like, then you see the results and you're like, oh, I didn't know it was going to be like this bad, So I think we can't take the risk here. Go build the system that has all of the shit that I said is missing here. And then maybe we can have a conversation about this, and including wealth distribution and housing and proper pain meds and proper treatment and proper like self-determination and agency inside these systems, all that stuff, fix all that stuff. And there might be room for a conversation. I don't know. But certainly with all of this howling inequality and systemic racism washing over all of these interactions, they're just soaked in it, right? So much so that I know people like my friend Simona, she just will not go to the doctor. Just her experiences have been so universally negative that she just won't even go. And I just know so many people like that. So these interactions are soaked in this kind of power imbalance. Why would we ever trust that room, that place, that discussion to make such an important decision when they're putting their thumb on the scale so heavy against us? Thanks very much for having me on the Filibuster. I hope I've contributed to busting the fillers. And I hope, if you're watching, any member of parliament, please do the right thing. This is not horse trading about votes. This is about lives. And when you see a community calling like this so clearly, you've got to listen. maybe the parties, the bosses, the liberals and the Tories, maybe they don't listen. I don't know, but the NDP oughta. And when they don't, that's just that's insult to injury. So yeah, thanks very much, everybody. Stay safe, keep six, and I guess it is on to our next speaker shortly. Oh no! Oh my God, I'm 6 minutes early. I don't have any art to show you though.
Well, I am just all the way out of the loop about all of the times back here. I didn't even know when you were ending. I was like frantically texting. I'm like, Garth sounds like he's wrapping up. What's going on?
Oh no. Yeah, I was scheduled for a half
we're
hour.
Fine. That's fantastic. That's great. It's I listen to the podcast, obviously, like also a drug user here, and really fantastic to like have you on the filibuster. Like I've been working back end, and yeah, just fantastic having you on here. So
can I just say,
yeah,
like, thank you for organizing. Like, what a herding cats operation this must have been. I can't even imagine. And like people like me who are typing my email address into the thing wrong, like I'm just making it worse. So just, yeah, thank you for doing that. And hey, to all of the Nazi assholes out there who were, Zoom bombing, I just got a message for you right there. They're 3D, also available in UK version, just in case you're across the water. Yeah, thank you
we're
for
all
having
inclusive here. We're all inclusive here.
Yeah, everyone bring your own. Those are the only two I know.
Yeah, I mean, we're just transitioning into like a really chill chit chat, me talking to myself